Okay, so we're about at 20 attendees. So good morning, everybody. Listening session. My name is Aisha Davis. We'll be doing more thorough introductions in a moment, but I would like to just welcome you all today. Today, I will be helping to facilitate today's conversation, and my colleagues Tim and Nadeen will be joining as well to help us with this PowerPoint that you can see. So right now, what I'm going to do is go ahead and share a document. Oh, I just saw this chat comment. Yes, Zoom has been failing, but not failing us, which means that we have a real reason to be here. So I'm going to go ahead and drop into the chat a document about our policy priorities highlights so that you all can see that. And then I'm going to also share a couple of other things throughout that I'll be drawing your attention to. So also, if at any point you see a cat jump across the screen, it's because I have a cat. So that's just what it is. Today's objectives are for us to develop a shared understanding of AFC's policy priorities development process, to gain more knowledge of AFC's current 2021 policy priorities, and to provide input, well, for you all to provide input to us to help inform any additional or new 2021 policy priorities for AFC. Today's agenda includes introductions, which we'll get to momentarily. Then we will turn to discussing some community agreements. We will allow you to add any other community agreements that you feel are important for us to have during this conversation. We will then pivot and talk about the history and background of this policy, then talk about the current 2021 policy priorities, and then move into a pretty robust discussion session, which will take up the majority of our time today. And then we'll have some wrap up and next steps conversations. So first, we're gonna go ahead and do introductions. I'll start and then I'll kick it off to my colleague Tim and then Nadeen. My name is Aisha Davis. I use the pronouns she, her, and her. Chat, we're going to ask that you do the same in terms of introductions and then answer the question, what COVID-19 policy would you want to carry over outside of the pandemic, if you could carry over any of them? Okay, so while Tim and Nadeen introduce themselves, feel free to type your responses into the chat. Go ahead, Tim.
Good morning, everyone. Thank you so much for joining this meeting today. My name is Timothy Jackson, Director of Government Relations for AFC. My pronouns are he, him, and his. Nadeen?
Good morning. My name is Nadeen Israel. My pronouns are she, her. I am the Vice President of Policy Advocacy here at AFC. And I'm really curious to hear what folks say in the chat about this question, because I have a list of policies that I would want to keep.
And in our carrying over the enhanced and expanded telehealth services and telehealth policies, which is absolutely amazing. Someone just shared they would like to see the increased hand hygiene continue. Amen. Yes, let's continue carrying forward these hygiene, these elevated hygiene routines that folks have now assumed. And I'm having a little bit of technical difficulty in terms of sharing the document, so I'll keep trying to do that as the conversation continues. But if I'm not able to do that before we end, I'll figure out what we can do. I see that another person said that they would like the awareness of the connection between health and housing to continue, which is absolutely important. Okay, so I think those are the first things that we have. We'll be saving the chat and looking at all of the policies that you all would like to continue beyond the pandemic. Reading policies for Medicaid, amen. Yes, agreed. So in terms of our community agreements, I'm gonna have them on the screen now and then I'm gonna share them into the chat so folks can see them throughout. First, speak from your own experience. This is a very important one. It means using a lot of I statements and not really falling back on generalizations, which is really easy to do. Make space, take space. So if you feel like you have heard yourself a lot, or if you feel like you haven't heard yourself at all, make sure you're keeping that awareness going. Slow it down and break it down. One of the easiest ways to explain this agreement is that we all tend to fall into the use of acronyms because we're so comfortable with the language that we're using in the area that we work in. So slowing it down and breaking it down means don't rely on the assumption that we all have the same foundational understanding of all the things we're talking about. We're all teachers and learners. This is extremely important because in conversations like this, there is no one person who knows everything. So we come into these conversations with the understanding that we're all teaching and learning at the same time. Respect one another and honor the time we have together. That means be very present while we're having this conversation. I know that it's early for some of us. I am not a morning person either, but robust conversation possible. Minimize the use of electronics not directly related to the meeting. This rule has always been fun before the pandemic, but after the pandemic, it means just use your laptop, because we're on those right now, or your phone if you're on your phone, and try not to get distracted by other things. I know it's difficult because a lot of these laptops have a lot of notifications popping up. So do your best to try to stay mindful of that. And then give each other some grace while holding each other accountable. This is kind of the oops, ouch rule that some folks might be familiar with, which really means that with the understanding that we are all human and we all make mistakes, that there are times where those mistakes might happen and cause harm. Any of us talking. So it doesn't matter if it's me, Tim, or Nadeen, or if someone in the chat says something. If someone says something that is harmful, name it. And if someone has said that what you've done was harmful, please acknowledge that. We want to make sure that this is a conversation that everyone feels not only included in, but also feels safe in the process of having. So are there any other community agreements that we would like to add to this conversation? Because now is the time to share them. And if not right now, it's always an open conversation. So if something does come up, please feel free to share that in the chat as well. I'm going to go ahead and drop these community agreements here because we're going to be moving into our next portion of the presentation. And I want you all to be able to keep it as a reference. There you are. Thanks. And now I'm going to hand it over to my colleague, Nadeen.
Thank you, Aisha. So we thought it might be helpful to spend a few minutes on the history, the history and scope, as well as the actual process that we typically go through annually, just to kind of, again, have a shared understanding of both. So I apologize because I thought we would be able to drop the document that Aisha mentioned. Essentially, all it is we pulled together highlights of our policy advocacy priorities over the past 5 years in one spot to kind of help you all, and we'll email this after the conversation, but essentially to help you all get a sense of like the type of work, the type of issues that we focused on. So it's going to be no surprise that a lot of it touches a lot of the policy priorities that we have worked on in the past are around HIV, whether it's access to care, medication, prevention. We've also done a lot of work around the Medicaid program. 3 in 5 people living with HIV in Illinois are on Medicaid, thanks to the Affordable Care Act and the Medicaid expansion. So the Medicaid program is critical when it comes to access to care, both in Illinois and across the country. And we've also worked on and supported leaders in other issue areas. So for example, housing, minimum wage. We typically work on the state budget every year and do advocacy around the HIV funding. Last year, we actually began doing advocacy around a new funding line item that we'd like to see around the SDI funding. Housing advocacy, supportive housing, increasing dollars that go to preventing folks from going into homelessness is another example of policy priorities we've worked on in the past. And then we have not a ton, but we have kind of dipped our toes into issues that touch on criminal justice as well. Able to get it following once the webinar is done. So that's kind of the little bit of the history. In terms of process, so a lot of times when we talk about policy work, we certainly have gotten a lot of questions over kind of our careers about, well, how does the process happen? Like, what does it look like how do you end up with the like 3 to 5 issues that you prioritize every year, whether they're bills, so legislative, or administrative policy advocacy. So the way to kind of think about the way we do our work is we line up our year with the state legislative session. And so you can kind of think of it as two parts. The first part is January through May, and I typically call that like execution time. I call it that in my mind because that's by January, we have our policy priorities. We kind of know what we need to do, and it's a matter of implementing. It's a matter of advocating, making phone calls, lobbying in Springfield, rallying together, writing emails, doing what we need to do to get our policy priorities over the finish line legislatively. The state legislative session in Illinois ends on May 31st. And so that's the point where we kind of wrap that portion of the implementing time and doing that type of advocacy, and then move into June and July. We're typically reflecting back. So we're looking at how did we do? How did session go? Where did we win? Where were there not as much movement? What lessons learned do we have? December time is bullets 1 through 3 that you see in front of you. So we start with ask and listen, right? So this conversation is the ask and listen process. We ask our external stakeholders, we ask internally, we talk to our own colleagues at AFC, who we have a lot of program staff, we do a lot of service delivery ourselves. And so we're asking community, essentially like asking and listening. Once we've done that, then we need to take that information and summarize it and analyze it. We need to take a look at what's come back to us and what lines up with work that we were already prioritizing, and what might be a new or emerging issue area that we should look into. Then kind of towards the fall, we need to start deciding what's kind of surfacing closer to the top in terms of what we're going to prioritize for the next year. Because once we decide that, there's probably a couple months worth of work that needs to then happen to flesh out what the solution is going to be. Is the solution going to be a bill? If it's a bill, what is that bill language going to need to be? Negotiating that part of it. Does the rule change need to look like? Who needs to be at the table? Subject matter experts, other folks that might want to weigh in, so that we get closer to those kind of 3 to 5 policy priorities as we get closer to December. The report back part comes around December, early January. So by that point, we finalize our policy priorities. Again, we know what our marching orders are, and we need to report back. So we share that back to our external stakeholders, internally to our board, etc. And then this last bullet, implementing and monitoring, again, we've now moved back into January through May, where we're implementing our policy priorities. And the monitoring portion is really, really important, because once something has been put into place, we need to monitor it to see how it's working and if it's working the way it needs to. So this year, we are being a little bit more intentional about a couple of things. One, writing it down. So we think one of the things that's really important in terms of just raising all of our kind of knowledge about at least how we do the process here at AFC, but also being on the same page and increasing transparency, is to write things down. So that's part of the reason why we wanted to have this part of the conversation before we delve into the discussion. The second piece is in looking at just between COVID, the uprisings that happened that really took off after the killing of George Floyd, as to the impact of racism on public health, I think that's been erased for a lot of folks. And one of the things that we wanted to name and kind of call out and center with our policy advocacy work at AFC is that racism is a public health crisis. And we wanted to kind of make sure that we move that more into the center of our work for several reasons. So one, we know that racism is the root of health disparities and inequities. And that it's actually racism and not race that puts Black, Indigenous, and people of color at higher homelessness, experiencing violence, experiencing poverty, and any involvement with the criminal justice system. So it's really important to kind of, again, center that and call it what it is. It is racism that is at the heart at all of these issues. We also know that anti-racist work will continue. So we've used a race equity lens with our policy advocacy work for at least, I've been with AFC for about 1.5 years now, for at least the past few years, probably longer, even longer, within our policy advocacy work. And part of that is naming it. We also recognize that any policy advocacy solutions that we work on to dismantle white supremacy, to be anti-racist, they have to be robust and they have to be comprehensive. This is a 400-year plus old crisis that we've been living through as a country, as a state, as a city. And so our solutions, our policy solutions, our systemic solutions need to be. And really, at the end of the day, if we are going to achieve the goals of the Getting to Zero Illinois plan, which is our state plan to end the HIV epidemic here in Illinois over the next decade by 2030, our policy advocacy work, we know at AFC, and we would argue across the state, has to continue to center dismantling white supremacy and addressing historic systemic racism in order for us to get to that goal of ending the HIV epidemic. All right, let's see if this will keep going. There we go. And now I'm going to turn it over to my colleague, Tim, who will walk us through for just a few minutes on our current policy priorities for 2021.
Thank you so much, Nadeen, for grounding our discussion and kind of the background, the history of our policy work here at AFC, but explaining the process as we move forward. Of course, this past spring session of the General Assembly was very, very different. And so the 4 topics that are on your slide that you see that I'll go over in just a moment are actually, kind of unfinished business, things that we've worked on for quite some time that, of course, because of the very different nature of COVID changing a lot of things, we did not get to a desired end. So I'm just going to go over these pretty quickly. The first one is the Prescription Drug Affordability Board. AFC, our policy team, is working with the Protect Our Care Illinois Coalition on this measure. And basically, essentially what this board would do would create the PDAP, as we call it, the Prescription Drug Affordability Board. It's an independent, nonpartisan body tasked with reviewing high-cost prescription drug prices and setting upper payment limits. Naturally, anytime that you start talking about HIV care, you're talking about prescription drugs. And so we understand that HIV medications are extremely expensive. And so this is something we want to be very intentional about. Prescription drugs are great, but only if they are affordable. And so that really kind of centers our work on the Prescription Drug Affordability. Partnering with the ACLU of Illinois on this measure. And essentially the goal of this bill is to make the sexual health education curriculum here in Illinois inclusive and affirming, and basically provides youth the really full toolbox of knowledge to make their own informed decisions about their health, and to be able to live their best lives. Specifically, the Healthy Youth Act deals on the current curriculum standards for health and sexual health education, but also removes outdated stigmatizing language that we know historically discriminates against members of the LGBTQ community, as well as those living with or vulnerable to HIV. And so again, this was another measure that we had a lot of great momentum, and we look forward to continuing to work on this measure in 2021. The next one is HIV criminalization. Although we did not have a bill, we were doing a lot of the foundational work, the community outreach, the familiar with that. Basically, there are laws on the books that criminalize people living with HIV. Essentially, if you are a person living with HIV and you do not disclose your status to your sexual partner, you can be charged with a felony, 3 to 7 years in jail with $25,000 fine. And so we're working through the Illinois HIV Action Alliance Coalition to do a lot of that, the community outreach and education, to look at the possibility of repealing the state's criminalization law. And hopefully we'll be looking at repealing that law in the 2021 or 2022 General Assembly session. And are always working on our engagement on state budget funding for HIV and STI prevention and treatments. Nadeen really set up the groundwork, big buckets that we're really looking through. It's one, the Getting the Zero Illinois plan, but then also the racial lens, and of course racism is a public health crisis. And so to meet the priorities of those, we are advocating yearly for increase in state funding for HIV treatment and prevention services, including testing, including PrEP, additional money for the African American HIV/AIDS Response Fund. In addition, to the increase in HIV funding, something we did this year and we will be continuing just for STIs. The STI diagnosis rates are rising here in Illinois among chlamydia, gonorrhea, and syphilis. And so we definitely want to be very intentional in our outreach and making sure that we get the resources there to begin tackling some of those issues. And so these are some of the four, big things that are unfinished business that we look forward to 2021. And I look forward to hearing from you all of some additional items that we get to add to this list. So with that, I am done.
All right, and now it is time for us to move into our discussion section of this conversation. We have these 5 questions that we are going to start with, and then we will turn to the questions coming in from the audience. I'm going to actually copy these questions and put them in the chat as well so that folks can reference them. That way we can switch over to y'all talking to us directly instead of necessarily just looking at this PowerPoint presentation. So I'm gonna go ahead and copy and paste those now and then get us started with the first question, which is, are there any clarifying questions about what you've heard? Or if you want to raise your hand, I think we have the option of letting you just go ahead and speak the question, and then we can respond to it that way. So I'm going to give folks a moment to go ahead and type up or prepare any questions that they might have. And I'm going to put these questions in the chat. Okay. Also, yes, we have confirmation that we can allow folks to voice their questions. Awesome. Year on setting priorities. Nadeen, I'll let you handle that one.
Yeah, so essentially June through December is, I call it planning and thinking time. Yeah. And so that entire time is for setting priorities essentially, but we do need to kind of cut off the point of the input so we can start, like I said, remember it's ask and listen, analyze, summarize, and analyze. So the ask and listen portion is usually a couple of months, so we're kind of in it right now. We'll probably wrap it up. We're hoping to do a survey as well to kind of disseminate that, another way to get more input. So we'll probably wrap it up closer to end of September. We can't probably push it more than that so that we can start doing the summarize and analyze portion and then start narrowing down. But the whole thing essentially is right around June is when we're reflecting and start thinking forward. And we need to be wrapped up with our policy priorities by the end of December so that we can
saw a question. I don't know if it's necessarily a clarifying one, but I think it is. So I'm going to go ahead and ask it and answer it. The question was, why isn't the African American HIV/AIDS Response Act included in the list? And Tim mentioned it. So Tim spoke about it. It wasn't in the list. The list is like the shortened version of things. We didn't want to over encumber any of the slides. So Tim did mention that the African American HIV and AIDS Response Act is something that we definitely have talked about and do plan on continuing to discuss and advocate in response to. Okay. We have a question. If a person is HIV positive and is having safe sex wearing a condom by law, do they have to disclose their status? I'm going to turn that one over to Tim.
Based on state law, yes. And that's the very thing of the state law as it's currently written does not take into effect current science, does not take into effect treatment as prevention, U equals U, or any of the new science surrounding HIV. It is heavily stigmatizing for people living with HIV. And so we want to remove that because if you are on treatment and you are undetectable, you pose no risk in passing on the virus. But then again, we want to look at it very outwardly. No other disease has this type of stigmatizing punishment around it. And so we definitely want to work to remove that. Great question.
Sorry. Thank you, Tim. And then we have one more question about if AFC plans on addressing CDPH funding. And I will turn that over to either Tim or Nadeen to respond to.
I can take this one. So one of the things that part of what I should have shared about kind of historically, our policy advocacy work at AFC has centered around the state level work. I remember when I was onboarding Tim and Aisha into their roles, I kind of roughly broke it down. I would say like 60-ish% or so of our policy advocacy work falls at the state level. That includes legislative and administrative policy work. So legislative meaning bills in Springfield, but also administrative policy work. So working with IDP agents and HFS, our state Medicaid agency, DHS, the Human Service Agency, and other state agencies. I would say about 20-ish or so percent, 25% of our policy advocacy work is at the federal level. So we are part of, mostly through coalitions that we're a part of at the federal level. And then a smaller portion is at the local level. And that typically is at the city level, City of Chicago, and a little bit at Cook County. The way that looks, honestly, is it's mostly where we are kind of pulled into specific issues, either because we have subject matter expertise, or there's kind of a unique value that is missing that we can add. And so that's how kind of typically our policy work breaks down. We do a lot of programmatic work, of course, at the city level and the collar counties, Cook and collar counties. But that's kind of how our policy advocacy work breaks down. And I will say a lot of this is also, that's kind of historically, and in thinking about the future, it's all about capacity. So as y'all I know are very familiar, doing policy advocacy work, lobbying, you have to use unrestricted dollars, unrestricted funds. And so it's the capacity of fundraising to be able to get more capacity on staff to do more work, whether it's at the state, federal, or local level.
Thank you, Nadeen. I don't see any other questions at the moment, so feel free to, oh wait, no, there's another one. Are we going to add HIV and aging as a need to be addressed?
Yeah, that's a great question. Thank you for raising it, Roy. So it's actually, it is, HIV and aging is a kind of an issue that is weaved in to a lot of our policy advocacy work already. And one of the things that we are, and in a couple of ways. So one, we didn't talk about Pride Action Tank, but Pride Action Tank is part of AFC's policy and advocacy team. And they have an out aging project, which I know you're familiar with, that's kind of specifically dedicated in thinking about even more broadly. So as people who are LGBTQ are aging, as people living with HIV are aging, what are the implications? What services do we need to have in order for that, any kind of health and human needs, housing needs that are unique to these populations for them to be addressed. Getting to zero is another example where there's a bunch of different working groups. One of the working groups is essentially older adults living and aging with HIV, focused on that. So those are just kind of a couple of examples, but the shorter version is that issue and that kind of population is opportunities that present themselves where there's a specific need, where we're going to be able to add value by weighing in legislatively through a bill, either leading or supporting somebody else who's leading, or administratively, we would absolutely take that opportunity.
Okay, and we have another question about the timing for the HIV criminalization work. So the question is, why would the HIV criminalization work potentially be done in 2022 rather than 2021? Is it just the amount of work that is needed and how long it will take? It would be great to hear more about what the plans are.
Absolutely. Great question. Yes, that's you hit it on the head. Naturally, when you're dealing with an issue that is going to be honestly very controversial, you want to make sure that you cross all your T's and dot all your I's, and make sure that you really have the pulse of the community. So making sure that we do all of the community outreach, that we are talking to legislators to really get their sense. We are doing a lot of that right now on a couple of fronts. On the community outreach part, we have been planning and have several more to go. Community webinars. Had one, HIV, the harms of HIV criminalization, had a powerful testimony from criminalization survivor. So be looking forward to that information moving forward. But then also Nadeen, I, and other people on the coalition are meeting with legislators, really talking to them about this issue. Some of them have heard of it before, some of them haven't. And so with that comes education and making sure that we're answering all of their questions, and as well as the communities. And so a lot of that is just kind of prep work. Our goal is, just to kind of give you kind of bird's eye look, we've been doing a lot of this community work, legislator outreach, and the coalition should be making a determination within the next couple of months or so, whether we will be running a bill next year or the following. Great question.
It was, definitely. Thank you for all these great questions. At this moment, we're going to pivot to the next question we have on our list. Feel free to keep typing questions into the chat. One takeaway you have from what has been shared so far. And that can be any type of takeaway about the presentation, about the information we shared. I already know that someone mentioned really liking the community agreements. So, you know, anything that you feel help benefit you today would be helpful. Also, feel free to raise your hand if you want to speak instead of type. Okay, we have one, an appreciation for having the context of AFC's policy and advocacy calendar and how activities are spread throughout the year. Awesome. The community agreements, thank you. An appreciation of the breakdown of the process that we utilize. Hearing what the priorities towards policy and legislation are for AFC. Okay, awesome. It sounds like a lot of these are about communication and knowing, I guess, the work that we're doing every year. So we'll definitely take note of that and remember that going forward. Centering racism, yes, okay. And feel free to keep typing those in. I'm gonna go ahead and say the next question out loud. Okay, so given your work on behalf of and alongside of people living with or impacted by HIV, or your understanding of this work, What are the top 3 challenges people living with or impacted by HIV face in achieving their best health? I think that there was actually, I think that there was a comment about that earlier that I'm trying to find. I think
I think it was Kenya.
I see it. Here we go. Top 3 challenges are income and income stabilization, housing, and unauthorized disclosure by friends, family, and ex-partners, where there's little to no practical solution with this type of disclosure. Yes, those. Anyone else want to name 3? Okay. Racism, stigma related to HIV and income, poverty, economic instability. Yes. All of these things. Racism, racism, racism. Okay. Lack of cultural competency in our own communities. Okay. And feel free to keep typing responses to this question and any of the other questions into the chat. We'll keep monitoring those. I almost feel like we should have some background music playing while folks type. Racism and homophobia, absolutely, absolutely. And I would probably add to that list transphobia too, just because of the disproportionate impact of HIV, the HIV epidemic on trans folks, trans and non-binary folks.
As people are continuing to enter their comments into the chat, I am noticing as a trend is determinants of health, which is so very important that we really be very intentional and thought-provoking on how we engage just that is not just the health column that we worry about, although very, very important, that we look at these other things like poverty, like housing. I tell people a lot of times, we all know housing is healthcare. You look at all of these other different issues. Of course, racism plays a huge role in a lot of these different traumas. Jesse, thank you for mentioning. And so it's thank you all so much for being very open and transparent on that. Yeah, thank you.
Okay, yeah, and then Jesse, in addition to saying trauma, said mental health symptoms that result from trauma and substance use to cope with trauma and mental health systems. Yes, absolutely. I think that this year we've seen, we already knew this beforehand, so more of the interconnectedness of these issues that we're talking about. And I've seen it come up a lot in conversations with coalition members where we're talking about what stuff, how access to healthcare impacts all these other things, how racism plays a part in all of them. So yeah, these are not any individual thread that you can pull away from the others. And the fact that they're all interconnected is why it's so beneficial for us to work in coalition with other groups, and why we want to have conversations like this so that we can hear about different perspectives that we may not have inside the organization. So thank you so much. Okay, housing, drug prices, and homophobia at senior centers. Okay. People not feeling like they're being heard or recognized despite forums. Okay, I'm gonna move us into the next question, but please feel free to keep typing your responses. If we could start over and resources were limitless, what would we create to end the HIV epidemic? Think in abundance and not in deficit, which is it's a very difficult thing to do because a lot of times we have this idea that well, not even just this idea that, but a lot of times we are told that there is a limit to what it is that can be accomplished or what can be done. So this is really one of those moments where if you had a magic wand, if you had a fairy godmother, if you had whatever you could imagine, what would you have, what would you create, or what would you make permanent that would help address and end the HIV epidemic? So I'm seeing affordable housing for all. Yes, absolutely.
Universal basic income.
Yes.
Healthcare for all.
Yes. Expansive cultural community engagements. Yes. Oh, I think that the response, I don't think that this was part of this answer. Okay, Kenya. I think that was the response to the other one. All right, Michelle, acceptance rather than stereotyping people living with HIV so that white straight people couldn't minimize the epidemic. Okay.
Wow.
Yes. Affordable medical care. Yes. And I think you also, I think Roy said that one and also said free medication. Yes, absolutely. Creating an open, honest, accepting culture around sexuality and okay, previous question. Thank you, Creola, for the clarification. Got it. If I could start over, I would change the messaging around who could be impacted by HIV. Absolutely, absolutely.
Yeah.
Yes. Avoiding terms like white gay disease or black gay disease, but understanding the widespread ability around HIV. Yes, yes, absolutely.
Y'all were on it this morning.
I know. I feel like everyone had their coffee this morning. Everybody had their coffee this morning. I'm very excited. Thank you for all of the honesty that y'all are giving us this morning. Yeah. HIV/AIDS addressed as regular checkup like the regular flu or TB or other relevant diseases. Yes, absolutely, absolutely. And that's a whole part of the like normalizing of this conversation, right? Like I think a lot of these things are able to fit hand in hand, because if it wasn't looked at as a disease on people who are queer or gay or lesbian or bi or whatever, if it wasn't looked at like that, or if it wasn't looked at like something that happens to people who are quote unquote immoral, right? And just seen as like a TB checkup, it would absolutely be something that we talked about more regularly. You're right, Creola. Normalizing discussing sex. Yes, absolutely. It goes right back to the Healthy Youth Act and why we want to make sure that that's something that we continue to think about and talk about. Yes. Okay, I'm gonna go ahead and name our last question. Please, please, please keep typing in responses, y'all. This has been a really, really great exchange. Okay, what do we need to do or put in place to make these things happen, right? So all of the things that we're talking about, all of these wonderful suggestions and changes that we would make if resources were limitless and the sky was not even a limit, right? What do we need to do to make these things happen? And to achieve it, right? Okay, seniors having sex also, yes, they do, yes. And there's little to nothing being talked about in terms of seniors and sex, yes. Elect public officials who actually care about folks living with HIV and understand systemic racism. Absolutely, absolutely. Provide universal income for all, yes, yes. Work to end gerrymandering and increase voting access and voter engagement. Absolutely. Absolutely. I think that you will have no opposition from this team on that one. Making it more difficult to evict people. That is absolutely something that has been coming up a lot in the conversation around the pandemic as well, especially around the to September, I believe, through September 22nd. But yeah, the fact that we have to figure out what date that moratorium ends and have to I guess, start thinking about the huge influx of people who will be affected by evictions, given all of the economic issues happening because of the pandemic. More Black executive directors in HIV prevention. All right.
And Anton,
Subsidized housing.
You go ahead.
Go ahead.
Anton, I would completely agree with you, and I would even add not just HIV prevention, but HIV period.
All right. Subsidized housing providers cannot evict people for owing a small amount of rent. Okay, yes. How can we leverage the resources of Black, Brown, minority agencies to increase capacity of and develop Black, Brown agencies downstate? Yes, absolutely. Recognizing the racism and sexism in eviction? Absolutely, yes. Y'all, I did not expect to get such a wonderful response this early in the morning. I don't know, maybe it's just early to me, y'all, but this is still early for me. Go ahead, Nadeen.
I was just going to say, and I'd be remiss to not mention the fair tax and all of these wonderful solutions, because that is a solution. So in addition to getting the vote out and voting and making sure that the vote is protected, in Illinois, voting yes on the fair tax, it's not the solution to all of our financial issues, but it will take a huge bite of the apple in terms of getting the state where it needs to be or close to where it needs to be to bring in more money to fund all of these wonderful, I shouldn't even say wonderful, basic needed services, human needs.
Mm-hmm.
And so just getting the word out about the fair tax, voting yes on the fair tax is going to be critical to really our future as a state and the future of what we can do in terms of resources for our communities.
Thank you for mentioning that, Nadeen. Go ahead, Tim. I see you.
Yeah, Kenya, Creola, and Michelle, thank you all so much for those last points. I mean, y'all, the prioritizing homelessness prevention is huge. Addressing the root cause of eviction. I think so often we talk about symptoms, but not the root cause of not just eviction, but a number of issues. We kind of get on the fringe, but never the meat of the matter. And so I think you all are spot on those.
Mm-hmm. And then Creola, your suggestions. So policy changes, what's included as regular checkups? Yes. Reallocating funding from policing to healthcare? Absolutely. Relative funding for Black-led organizations so it is equitable to incidents of the virus? Yes. Equitable is the word of the day. I'm here for it. And Whitney? Then we have a question from Whitney. Is AFC doing work around the fair tax plans?
Absolutely.
Yes, we are. Go ahead, Tim.
Absolutely. We're working right now on a couple of things. We're doing some social to put together basically a whole advocacy action plan centered around not only the fair tax, but voting by mail as well, as we move really into election season in the fall. So we're doing a lot of that. We will also be hosting, next month, a conversation about the fair tax that Aisha and I will be talking about. And so just kind of stay tuned. We will definitely be doing some work around the fair tax.
Yeah, and we also have some mentions of the fair tax in our policy newsletter called The Debrief. If you are not signed up to get The Debrief, please feel free to do so. I'm actually going to go ahead and say sign up for The Debrief and also sign up for P2A. P2A is our way of texting you about certain actions that are happening, keeping you in the loop of the work that Policy and Advocacy is doing. It's also one of the ways that we help really get folks geared up and keep them in the loop about our advocacy day that happens in the spring. So if you have not signed up for, I'm gonna go ahead and ask my lovely colleague Meg, who you can't see, to share the information on how to sign up for The Debrief and get plugged into P2A. And I see that we're at 10:51, so we have about 4 more minutes to submit any more comments, responses to the questions that we've had, or submit any other questions that you have before we go into our next steps and wrap up section. So please keep flooding the chat with all the things that you all have been talking about, all the wonderful suggestions and conversations y'all are starting. I also love seeing that so many of you know each other and are saying hey in the chat. It's definitely a group.
I was just gonna say that. I love it. It's as if we were together in a small meeting.
If only we could have a meeting like this in person, but you know, safety first. Safety is the most important thing.
Absolutely.
All right, thank you, Meg. Okay. Kenya said,
Woo!
overhaul the disability system and implement a true tiered disability system for those who can do some work but not work full time due to their disability. Yes, absolutely. Absolutely. Creola, thank you for your comment. We'll definitely keep that in mind.
I think we have a work-life balance conversation this week between Tim, Aisha, and I, if I'm not mistaken.
Okay. Any policies not mentioned yet that you're thinking of making priorities in the future? Okay, I'm gonna leave that one to Nadeen.
Yeah, so thank you all. This is really, really helpful. So I think that a couple of things that have, this is like maybe the 7th conversation we've had, kind of more intentional, where we're part of a lot of coalitions, of course. And so this is a time of year where our coalitions are also having the same conversation. But one of the things that's risen to the top, both in this conversation, it's seeming like, and in other conversations that we've had, is housing. So we've done some policy advocacy work on housing, kind of supporting on the budget side and some specific policies, but we're looking at how we can more intentionally add value to the housing tables. Again, there's already policy tables that exist, leaders in that space, organizing, community organizing leaders in that space. So how can we add value in that space, in that issue? Roy mentioned housing specific to the needs of older adults, and especially older adults that are living with HIV. So where are there opportunities for us to add value there? Criminal justice system. So this is a little bit more newer to us in addition to policing. But in thinking about, I think Creola made the comment about like, essentially moving money away from policing and moving it into healthcare and other kind of other, like I said, basic human needs. So these are a little bit more newer issues to us, HIV criminalization being the exception. But we are looking at, again, and thinking about, we have a finite amount of resources. We're always going to advocate for more resources, but there's always going to be the reality of a finite amount of resources. And so how can we take a look at where our government is spending money right now and where they should be spending the money? And the areas that we know are kind of low-hanging fruit. Again, it's not about us leading in these spaces. There are already leaders in those spaces on the policy end, on the community organizing end. It's about how can we add value? One of the things that we didn't mention is the state, so the governor's office is working on a widely known kind of criminal justice package that will hopefully be introduced in the fall. So as we've been having these conversations with our, internally and thinking more about this, it's thinking about like, how can we be a value add to that table, that existing table, to that conversation? And so we're still trying to figure that out, honestly, but those are the couple of things that have started rising closer to the top that weren't already part of our part of the mix, if you will. And Aisha and Tim, please add in if I missed anything.
Hey, yeah, I would add that yes, we have policy priorities, but there are other measures, especially when it comes to legislation or other sign-on letters to state officials on a number of administrative policy issues that we work on. And so, we want to be kind of mindful of that. Last year, like I said, we were working on those 4 major things, but we were also working on a number of other measures, including out-of-pocket prescription drug costs, Healthy Illinois for All, which basically provides Medicaid coverage to undocumented immigrants, and working on a number of other different issues that are important as well. And so it's not just the 4 that we have there. These are just kind of really the upper level, and then 1B, 1C, we come in and we work on a number of different other issues. Creola, to your question, a couple of things. Creola's question for the group, if you all don't see it in the box. Anything being addressed at state veto session this year? From my understanding with legislators, Creola, there are about 2 big issues or 3 that they're looking at. One is this criminal justice package that Nadeen alluded to. You know, as a couple of legislators kind of pointed out to me, they're calling it the criminibus, a criminal justice omnibus bill. And so that's going to have a number of different things in it. Another thing that we're keeping a keen eye on is this continued discussion about telehealth. Telehealth has been a godsend during this pandemic, and so we really want to work to make sure that we continue that moving forward. And then, of course, the elephant in the room, COVID-19. And so whether there's going to be an additional relief package by the General Assembly in November, December, or if they're just going to hold off until the next session next year. So those are really, as I talk to legislators and others, those are the big three buckets or big items that people are talking about.
Thank you, Tim. And now I'm going to turn it back to Nadeen to wrap us up and talk about some next steps.
Awesome. Thank you, Aisha. Sorry, y'all, give me 1 second. Let me make sure I got the right slide pulled up. Okay. Oh. All right. So we have, I think, like 1 or 2 minutes left. Y'all, I have already gotten connected to e-communications, but just wanted to reiterate, really the best way to keep up with our work is to sign up for our e-communications, both the debrief, which is our e-newsletter, but also if you text AFC to 40649, that's how you get our action alerts, and it's a great way throughout the year to keep up with us. In addition to this listening session, please be on the lookout for a survey that I mentioned. Another way to collect more information, it'll be very short. Please fill it out if you'd like to, but also disseminate it. And then be on the lookout for our policy priorities, kind of the shaped up, finalized version in late December 2020, early January 2021, depending on how the holidays are shaking out. And then I just wanted to put up our contact information. Aisha and I was going to say Nadeen, Tim, and myself. And just say thank you all so much. This is an hour of your time that you've chosen to spend with us and give us your feedback. And we value it and we appreciate you being as honest and candid and creative as you have been over this last hour.
Thank you so much, everybody.
Bye, everybody.